Hi, I'm Gene, and welcome to AssessMinutes, where we take a complex assessment topic and break it down to make it easily understandable, because minutes matter. So we'd like to take just a few minutes to discuss how to interpret the information that you would see on a progress monitoring report for a student. Now, to be clear, the progress monitoring feature of STAR is one of the most advanced things that we have. It's very important, and sadly, it remains fairly underutilized. When we talk about progress monitoring, we're talking about looking at the growth of students who are placed in an intervention. And because of the nature of interventions, we need to know how much growth is realistic, and are students in a fairly short amount of time, are they growing enough to say that they have met the goals of the particular intervention? So let's take a look at this sample of a progress monitoring report here. And what's wonderful about this visual is it actually contains a lot of information. For example, each vertical line represents a change in an intervention. So if we look at the dates across the bottom, for example, I can tell that sometime near the beginning of October and running until almost February, the student was in one intervention. And then the teachers or the school decided to change and place the student in an additional subsequent different intervention. There are gold lines represented in here, typically with a star at the end, and the star represents the targeted end date of the intervention. In other words, in this intervention, the teacher's hope is that the student will grow at least this much, and generally the intervention is going to end at this particular date. Then we'll take a look at the individual star tests that we see here reflected by these blue diamonds and the trend lines that approximate the amount of growth that a student is getting. Now, progress monitoring is probably one of the most psychometrically advanced things that teachers are asked to do. And quite honestly, most of us did not receive training on this level pre-service. So there's a little bit of interpretation required. Let me give you one word not to use when discussing these trend lines, because sometimes people will say, oh, I see, there's the individual star scores, and then the trend line is an average of all those scores. That's not the word to use, and here's why. The mathematical formula that produces these trend lines is not one of averaging, because when you average 5 things, for example, you add up all 5 and you divide by 5. And so in that sense, each individual thing has just as much weight on the outcome as any other individual thing. Well, that's not what happens when a trend line is developed. And I don't want to totally scare you, but the mathematical practice that is applied to this, the statistical procedure, is referred to as linear regression. Now, most of us haven't studied stats enough to quite understand what that is, but it's also something that's very intuitive, and here's what it means. Take a look, for example, at the 5 scores in this particular intervention. They're all relatively clustered together, and to that, we look at it and we say, kind of makes sense. However, if there was a 6 score way up here, or perhaps way down here, if I'm working with people and say, well, what would you say about that score, or what would you call it? They would say, oh, that's an outlier. And the minute that we call a score an outlier, what we're saying is that score can't be as valid as the others. We know that scores that are fairly clustered together in progression, those are ones that we can rely on. And if there's another score that's particularly high or particularly low, we know that that is an outlier. It's not just as valid. Well, going back to that linear regression model, mathematically, that is exactly what linear regression does. It gives more weight to scores that are clustered together and less weight to individual scores that move away from the cluster. So if in this intervention there were a 6 score that was way up here, it would count as an upper score, but it wouldn't pull the entire line all the way up quite as high as it might depict visually. Or if there was a particularly low score down here, again, it would count as a lower score, but it wouldn't distort the line and drag it down here. One of the essential messages around progress monitoring is when you are trying to interpret these reports, generally, in most cases, the best advice is ignore the individual blue dots of individual scores and follow the trend line. Sometimes the dots will be higher, sometimes the dots will be lower. From a psychometric standard or psychometric perspective, what test writers would say to you is an individual score means relatively little to you when you're trying to determine whether a student is growing. It takes a cluster of scores pulled together before a trend line can be drawn for you that you can have faith in. So again, when you're looking at these reports, be less concerned about individual scores that are above and below. Take a look at the trend line, compare it to the growth goal that you've set, and then you'll know how to read this report correctly and make a determine whether the intervention is working or not.